there, my name is Zachary, and I'll be presenting a presentation on the basic human anatomy. So in this presentation, I'll be teaching parts of the human body to two volunteers right here. I'll be pointing out some of the bones and some of the muscles in the body to my volunteers, and afterwards I'll be giving them a little pop quiz on what they've learned, and hopefully they'll be able to absorb and understand as much in my little brief presentation I have for them right here. So we'll be starting off with the bones of the body. I'll be starting from the superior part, so from the head all the way down to the toes, which is the inferior part for the bones of the body and also the muscles as well. So we're going to start with the clavicle. As you can see, we have a clavicle on each side. This is also known as the collarbone. You can feel that as a little bony structure on your shoulder. Pretty much the little bony part. This is closely related to the scapula, which is on your back. So you know, on your back, it's your what's it called? Your shoulder blade. These both connect or are really close to each other. On the shoulder, as you can see right here, your clavicle and your shoulder blade, and they're both kind of close to the shoulder joint. Next would be the ribs. This is a very common one. Everyone knows what the ribs is pretty much. Your ribs, they protect your internal organs, so like your heart and your lungs. Next we'll be talking about the upper extremities, so like the arms. Here we have the humerus right here. The humerus is, I think, the second longest bone in the body. The first we get into later, which would be the femur right here on the lower part of the body. But going down from the humerus, past the elbow, we have the radius on the outside and ulna on the inside. So if you're standing in the anatomical position like this, just like that, you have your radius on the outside, and you have your ulna in the inside. So your medial side will be your ulna, and your lateral side from that side will be your radius, as you can see. Next, moving down to the lower part of the body, I was talking to you guys about the femur. The femur is the longest bone in the body and probably one of the strongest bones in the body as well. From this, you go down past the knee, so you have your patella and this part of your kneecap, going down to your tibia and your fibula. Your tibia makes up your shin pretty much. Your tibia is the stronger part of the bone. The fibula is more on the outside, so it's not as strong, but still creates that balance that you need when you are walking. If you are ever to break this bone, it's usually the fibula that you're talking about, but there are cases where the tibia does become fractured. And fracture and a break is the same term, so when it says fracture and you're talking about break, there is no difference in between those two terms. Moving on to the muscles. There's a little bit more terminology here you can see, and some of it can be pretty confusing. So we'll start from the superior part down to the inferior part that I talked to you guys about earlier. Start from your trapezius. As you can see right here, it's on the shoulder part, so just laterally, so coming from your neck down to your shoulders. Usually if you're if you're sleeping funny, your head's tilted funny, or you're sleeping in a really awkward position, if you wake up and you are sore in the morning, then your shoulders or your upper part of your neck does become sore, and this usually is your trapezius or your traps. Next, working down would be your shoulders, so your deltoids. Your deltoids are pretty much, they're a pretty strong part of the body. They are used for lifting things laterally and just to hold and push things, and they can be pretty strong and powerful part of your body. Next would be your pectoris major. This is also your chest, so your pecs. Moving down would be your rectus abdominis, or your abs. Your abdomens. Moving on to your extremities, your upper extremities, so your arms. You have the two common ones, so you have your bicep and tricep. Everyone knows your bicep is in the front, so it's more anteriorly, so on the front. And you have your triceps, which is in the back. And that is your in the posterior, and they are considered to be antagonist pairs, which they do work together. So the antagonist ones, agonist, antagonist, they both work to each other or work with each other. Going back to the rectus abdominis, your abs. On the sides you have your obliques as well, which is another part of your core. If you do want to ever increase core strength, this usually is your abs, your obliques, and your back. So you can't really gain strength in one, like have really strong abs if you don't have a strong back and strong obliques. That's what it said. Moving down lower to the lower extremities, so your legs. I'll be talking to you about your quads and your hamstrings. There's a couple parts of to your quads, because quad means four. First you have your vastus medialis, which is in the inside, so the medial part. Your vastus lateralis on the outside of the part. Not shown here, but you have your vastus intermedius, which is the inside part of your quad. And then you have your sartorius muscle. You can see here it hooks from the hip all the way down to the medial part from where your knee is, right there. Before going to the hamstring, I'd like to talk to you about your calf muscles, so your gastrocnemius, as you can see right here. Your soleus, which is just a little bit below. Your gastrocnemius is more the bulky part, the part where it does stick out a lot more than your soleus. As you can see right here, this is a picture of the right leg. You can see right here. You have your vastus medialis inside, vastus lateralis on the outer side, vastus intermedius middle, yes, and your sartorius that just goes from the hip all the way down to inside your knee. Then you have your gastrocnemius, just the more bulging part, your soleus, which is a little bit lower down. Moving on to the posterior part of the body. Again, you look at your trapezius, yes. Your teres major, you can see right underneath the armpit. One thing that people get confused with the muscle is because it's so close is also your latissimus dorsi, which is right below, but it's a larger muscle, you can see right here. And usually, I guess, when we do have lower back pain, it is in this kind of area, latissimus dorsi. But going back to the calf, you have your gastrocnemius, yes, and your soleus. But moving on to your hamstrings, so you have like three basic parts. So you have your bicep femoris, as you can see right here, your semitendinous, and one that's not shown here, just semimembranous, which I believe is on the medial side. I can't remember, but yeah, but those three parts are the major parts in describing the hamstring, which parts are there. So do you guys remember where the patella was?
That's the kneecap.
Yes, that's correct. Do you guys remember where the radius is? Which
The
part?
outside of your arm.
Yes. Of your forearm, yes. As you can see here, your patella, your kneecap, right here. And then you have your radius on that side. Do you guys remember where your deltoids are on your body?
And the shoulders.
Yes, that's correct. So shoulders. And your traps or trapezius? It's around the same area.
Is that in the back?
That's the neck.
Yes, the neck muscle. So if you're sleeping, you might have some pain in your trapezius. Okay, so I want to give you guys a little pop quiz on what you learned. So, where is the femur located in the body?
That's the one between the hip and the knee.
Yes, and I said it's also
The largest bone.
longest bone, and also the
Strongest.
strongest bone. Yes, the body. Where is the scapula located? You guys remember where the scapula is?
Scapula is, it's at the,
It's
It's considered a flat bone. Another flat bone in your body is your sternum.
shoulder blade.
it's the
Yes,
shoulder
shoulder
blade.
blade. Correct. And two more. Where is the ulna located?
Inner part of your arm.
Yes. The
Arm.
other part of the arm?
The radius.
Yes.
Okay.
That makes up your forearm from your elbow to your wrist, vice versa. Where is the fibula located?
That is the, isn't that the bones down by your,
Shin,
Below your
yes,
knee.
yes. And do you remember the other one? The one that works right beside it?
remember? Big, tibia. Isn't it?
Tibula.
Tibula.
No, tibia, sorry.
Tibia, okay.
Fibula, so fib, tib.
Which one is the bigger one, I forgot.
Tibia is the one. Okay, so moving on to the muscles. Where is the rectus abdominis located?
Your abs.
Yes,
Uh-huh.
correct. Where's your trapezius located?
That was the one,
That's your
Shoulder,
shoulder
yes.
muscle.
Shoulder, yes. Correct. Where is the teres major located?
Right under your armpit.
oh, okay.
This is right under, yes. And the deltoid, like,
There were the shoulders.
yes, the shoulders, correct. Okay. Thank you for your attention. Do you guys have any questions?
I just wondered where the ligament, like, what's the difference between ligaments and tendons?
Well, as you go back to the muscles, so ligaments and tendons, they both, I guess for example, around the knee, you can also have other examples around, I guess, like the shoulder and stuff, even though it's not like shown here. But your tendons, they link muscles to your bones, and ligaments are bone to bone. They just link bone to bone. So example, I guess, would be one of your quad muscles reaching down, going over the kneecap and going over the patella, and when it's contracted, it does pull your lower part of your legs or your shin up. So if you're doing like a bicep curl like this, you'd feel a little bit of tension. Well, you'd be pulling from, I guess, yeah. So it'd be like from the hamstring. So if you pull the hamstring, then you pull up your lower part of your body, which then does go over your patella. But usually ligaments are bone to bone and tendons are muscle to bone. So, and that is all throughout the body as well.
Thank you.
I believe that's everything. Thank you for your attention.